Hello and good day. This is Dr. Garcia and I will be discussing on diet and nutrition. So for this lecture, we will be discussing the concept of nutrition, the components of a healthy diet. We will be discussing malnutrition and other nutrition-related diseases, as well as discuss existing government programs and our advocacies on nutrition. So what is nutrition? So nutrition is basically all about what we eat. It is the kind of food, the quality of food, and the amount of food, which are essential for achieving and maintaining good health and development and overall good quality of life. To differentiate it from a diet, basically the diet is just what you consume, but the nutrition is a process in which you acquire nutrients or elements that are essential for sustaining life. Now that we've defined nutrition, let's look at its opposite, which is malnutrition. Now, malnutrition is just not a singular problem, it is a public health problem, and it is often caused by a lack, but it is also caused by an excess of calories and other essential nutrients needed for proper development and function. Now, we will be talking about terms like undernutrition more specifically rather than your overnutrition. Now, this is a problem that is closely linked with the social determinants of health. So, basically, there's a social aspect to this particular problem. So, it's sort of it's a disease actually, but it's not merely just a state that you acquire just by being sick. So, there are a lot of social aspects to it. But first, how do we determine undernutrition? So, in your DPC review notes, you have the following also. So just review. So this is one of the ways in which we classify or measure the a state of nutrition of somebody, particularly undernourished individual. So we use the Waterloo classification. So for wasting, which indicates acute malnutrition, we use the weight of the child. Okay? So basically, when we are talking about the weight of any individual, it's basically caused by an acute process. Okay, so hence this is the formula. So you get the actual weight of the child, usually in kilograms, and then you look at the WHO growth charts and you determine the ideal weight for actual length. So what you're going to use is the weight for height or length growth charts from the WHO. Okay, so you get that. So you divide the actual weight divided by the ideal weight times 100, you're going to get a percent. And depending on the value you get, these are the interpretations. So normal is above 90, mild wasting is 80 to 90%, moderate is 70 to 80, and then less than 70 is severely wasted. On the other hand, we have your stunting, which is an indication of chronic malnutrition. So this one is based on the height of your patient. So this is uh, indicated as a chronic process because your height basically indicates chronic growth. Okay, so that's why this is a form of, or a rather, a manifestation of a chronic process. Okay, so same as your wasting equation, except you use your height, you plug in the actual height of your patient divided by the ideal height for age, and then you multiply it by 100. And then a normal result would be more than 95%. Mildly stunted would be 90 to 95. And then moderate stunting would be 80 to 90, whereas severe stunting would be less than 80%. Now we also have the Gomez classification. Okay, but this one is used basically for prognostication and not just determining the degree of undernourishment. So here we have a different formula, similar to your wasting, but instead of the weight for length, you get the 50th percentile for weight for age. Okay, so basically you get what is the normal weight supposedly for the age of the patient. Okay, so you divide those and then you multiply it by 100, And then whatever you get, the value will determine the degree of malnourishment of your patient. So a normal would be 91 to 100. First degree or mild malnutrition would be 76 to 90. Second degree or moderate would be 61 to 75. And severe or third degree is less than 60. Another schema for classification is your welcome classification. Now, this one doesn't necessarily entail computations, so you base it on the degree of weight loss and whether or not there is edema. So, if you have 60 to 80% weight loss with edema, you basically classify your patient as having kwashiorkor. But if it's without edema, your patient is basically undernourished. If it's less than 60% weight loss, you can, with edema, you can have a marasmic kwashiorkor situation, whereas those without edema would be marasmus. So what are these terms, marasmus, kwashiorkor? We will be discussing it later on. Now, another means of assessing nutritional status would be by the use of tools. So one of the more popular or more well-known tools is the mini nutritional assessment tool, which was developed by the Nestle Nutrition Foundation and University of Toulouse. It's used basically for geriatric patients age 65 and above, and is a questionnaire consisting of 18 questions divided into the following categories. Now, shown in this slide is the algorithm by which you are to interpret and intervene if you detect malnourishment in your elderly patients. So these are all in your manual. You are free to read on them. Okay, now we go to the different states of malnourishment. So first we have the protein, energy, undernutrition. Okay, so if it's primary, it's basically because of inadequate nutrient intake. So what we mentioned before, we have your marasmus and kwashiorkor. So patient with marasmus is basically has a low intake of protein and calories and presents with severe wasting, as in the picture shown in this slide, this one. Okay, so that's your marasmic patient. Note that basically this is a patient who is all skin and bones, okay, because of the lack of protein and calories. Next, we have a kwashiorkor patient, which has generalized edema and whose diet is very low in protein but high in carbohydrates. So it's represented by this patient here below. So note that although he looks a bit on the stout side, this is actually a very undernourished patient. So that is not fat but is edema, okay, because of the low protein. Okay. We also have your secondary PEUs, or protein energy under nutritional states. Most of these are in one way or another a bit more reversible than the previous ones, no? The previous conditions I've shown you, kwashiorkor, marasmus, it may take years to bring the patient back, whereas the secondary types may need a more shorter duration to treat. So these are undernourished states basically caused by conditions that affect nutrient absorption that may or may not be temporary. Okay. So first are those that are caused by gastrointestinal dysfunction, in which there may be an impairment in either their digestion, absorption, or your nutrient transport. For example, your celiac disease, or if you have an gastrointestinal infection, let's say parasitic, or more commonly in pediatrics, if you have acute gastroenteritis, that may affect the absorption of nutrients. Okay, so these may be treatable, this may not, depending on the cause. We have also your wasting disorders, as characterized by your immunocompromised patients, your AIDS patients, in which there is some sort of inflammatory process going on that's interfering with their nutritional processes. And then lastly, we have conditions with high metabolic demands. Some examples would be those patients who have undergone trauma, or surgery. So they have a high metabolic demand because they require a lot of processes to be able to heal themselves. What else? There's also your burn patients who require a lot of protein to build up that epidermal layer back. Okay, so those are your secondary causes. Okay, now let's delve deeper into some nutritional disorders. Okay, so first off, we have your iron deficiency anemia. So in your lessons, you will learn that iron is essential for the production of RBCs, your RBCs, which primarily carry oxygen and other nutrients to cells. No? So this is a particular type of anemia. There are a lot of types of anemia. This is just one of them. Okay, and it may be due to acute blood loss. In women, this is more commonly because of menstruative processes. For some who have intestinal parasitism, for example, they have a hookworm infection, they may incur some blood loss, this more chronic, to produce this particular type of anemia. Other bleeding disorders may also cause this iron deficiency anemia. And then more commonly, there's a malabsorptive process going on in certain GI conditions. Now, how does iron deficiency anemia present? So it's basically not specific symptoms like your dizziness, weakness. Mostly, some would appear pale. And then if it's really severe or chronic, no, they may have difficulty breathing. Okay, you may also encounter patients with restless leg syndrome. Now, aside from an iron deficiency, patients may have a vitamin A deficiency or VAD. No? So you have a condition called xerophthalmia, which is a common cause of blindness among children and is due to a vitamin A deficiency. Now there are two types. Primary vitamin A deficiency would be due to due purely to poor dietary supply, whereas a secondary form would be due to decreased bioavailability or there's problem with their absorption of their vitamin A. Now, how does the vitamin A deficiency present? Again, could present with blindness, specifically at night, because vitamin A basically helps your rhodopsin, which is your photosensitive pigments in the retina, which are responsible for our night vision. Okay. Aside from that, you can experience also dry eyes, infertility, poor wound healing, acne, or other skin problems. For children, delayed or impaired growth and development. You may also be prone to throat and chest infections and dry skin, as well as dry eyes. Next nutritional disorder is your goiter or your iodine deficiency. Now, your goiter is basically a disease process which involves your thyroid gland. Now, your thyroid gland is the largest endocrine gland in the body, and it produces the thyroid hormone, which is responsible for regulating a lot of our metabolic functions, like it helps in regulating growth, temperature, etc. So basically, if it is affected, a lot of your processes will also be affected as well. And this type of deficiency is usually seen in populations with little to no access to fish or seafood, or whose diet contains goitrogens like your cassava, cabbages. Okay? How does it present? For children, it presents as cretinism, and it can result in impaired brain development and function, whereas in adults, it impairs metabolic processes, and if it's severely enlarged, it could also have pressure symptoms on your trachea, esophagus, and laryngeal nerve. Okay, so what is the government doing about all these things? So, since the 1990s, the DOH has a lot of nutritional programs in place. So, you have your Sangkap Pinoy, your supplementation program, okay, wherein vitamin A is provided in health centers to children. You have iodized uh, salt program or the fortification program, which is your Sangkap Pinoy. So those are your food fortification, your Fidel Salt, FBR rice, okay? And I will show you some of the Sangkap Pinoy seals, no? So you will see this in a lot of our locally produced food, okay? So this is the diamond seal on your left, and the center is your Sangkap Pinoy seal, and then for on the right side, it's basically for iodized salt, okay? Now, other intervention programs include we have legal policies in place that will help promote a good nutrition, hopefully for all. Okay, so we have your 8172, which is an act promoting salt iodization. 8976, which is the food fortification, hence your Sangkap Pinoy program. And then a recent one would be your Philippine Plan of Action for Nutrition, which was um, implemented during the Duterte regime. Okay. And then, of course, your support programs. Okay. So the FNRI does nutritional surveillance by doing surveys and other assessment programs, training of personnel, and operations research. Okay. You also have your Garantisadong Pambata program, which is a biannual week-long delivery of a package of health services of children from 0 to 59 months of age. So it includes your biannual vitamin A supplementation. Now, we mentioned this earlier, the Philippine Plan of Action for Nutrition. So I think this is also in your DPC review notes. So basically, the thrusts of this particular program is its aim to reverse significant wasting, certain deficiencies, and hunger and food insecurity, address overnutrition, address maternal nutrition, infant and young child feeding, complementary feeding, ensuring adequate nutrition within the first year of life, and the promotion of exclusive breastfeeding, especially for infants up to 6 months. And of course, breastfeeding is best for babies up to 2 years. Okay, so I'll end this with a proverb that says, when the diet is wrong, medicine is of no use, but when you eat correctly, medicine may be of no need. Okay? So, in summary, nutrition is a significant contributor to one's health condition. As we've seen, it affects a lot of your processes, and it may be associated with a lot of social determinants. Malnutrition is a big public health problem, and addressing it needs a consolidation of efforts at both the individual, national levels. So thank you for your time. Please send your questions through Canvas or through my email, or you may approach me when we meet face to face in the campus. Okay, thank you.